Sijapata wale wenye kudunga sindano.
Ukidungwa hiyo chanjo after 3-4 years unaweza kufa.
You can hear people say no, it's not COVID. She has cardiovascular issues.
A few weeks ago, the second phase of mass vaccinations against COVID-19 began in Kenya. The Ministry of Health's target is to vaccinate at least 10 million people by the end of June next year, 2022. In the just concluded first phase, the ministry managed to vaccinate slightly above 950,000 people countrywide in a campaign that was characterized with low uptake of the jabs in several areas, especially in rural counties like Marsabit, Tana River, Isiolo, and Lamu, among others. This was largely attributed to the lack of mass sensitization of the public on the safety and efficacy of the shots, particularly the AstraZeneca that is in use in the country, and the COVID-19 related misconceptions, myths, and misinformation that many people have been exposed to, consumed, and apparently believed in. Lamu County, for instance, that is home to approximately 150,000 people, registered 0.1% only of the total vaccinations announced by the Ministry of Health by the end of the first exercise. Sitting 470 kilometers west of Nairobi and off the shore of the Indian Ocean, Lamu is known for its rich coastal culture and the signature old town houses. The county has quite a unique transportation system, with speedboats and donkeys traditionally being the main means of transport before the entrance of border borders and taxis. It is at this transport system that we first come face to face with the harsh reality of COVID-19 vaccination hesitancy and how people here have lowered the guard as far as the containment measures are concerned. Some people in this industry don't even believe COVID-19 exists. Some, on the other hand, believes the virus exists but have adopted the wait-and-see attitude on matters vaccinations.
Kwa kweli kusema corona iko, lakini sijapata wale wenye kudunga sindano.
Ni Joginda.
Elijah Athman Roymen, a taxi driver at Mokowe, just like many of his colleagues who interact with a lot of people on a daily basis, has not taken the vaccine and says he's not ready to take one.
Wengine wetu hatujadungwa kwa sababu wengine tumesikia fununu kwamba ukidungwa hiyo chanjo after 3-4 years unaweza kufa ama uwe na kuzaliwa watoto wamepooza. Kwa hivyo sioni kama nitadungwa.
The youthful taxi driver says he has never seen or heard of someone suffer or succumb to COVID-19.
Sijaipatana na mtu yote mwenye anaugua corona katika hili eneo bunge la Lamu.
In our interview with the County Executive Committee member in charge of health, Dr. Ann Gadhoni, she confirms that locals here have been fed with a lot of COVID-19 misinformation and misconceptions, factors which, according to her, explains the low uptake of the COVID-19 shots in the region.
Even as we have been trying to do what we call behavior change communication, which is largely what we use in health to try and influence decision-making in regard to consumption of health services. A lot of this negative information we have been encountering it. You'll find it on social media, you'll find it even in mainstream media sometimes, especially when there's a major reporting of a negative event related to the vaccine in one way or another. We know in medicine, even the common drugs we take, most of them have a small untoward effect. You know, if you take paracetamol, it will tell you you may probably have a bit of nausea. That will not stop you from taking paracetamol when you have a headache. right? So even for the vaccines, we still have side effects here and there.
Anthony Wamai, a physiotherapist and youth leader in this county, seems to read from the same script as the CEC on the main drivers of vaccination hesitancy within this area.
Many theories and narratives have been peddled against the vaccination, simply because of some of the narratives that are not even very untrue. One being that after you take the jab, you definitely become impotent for the men. Women are a bit afraid when their men are being vaccinated. We also have another narrative that says after the vaccination, the side effects of the vaccine outweighs the benefit of it. That has really made people to develop some fear for them to be positive about the vaccine.
And to get a clear picture of the COVID-19 vaccinations in the Lamu County, we decided to visit the Lamu County Referral Hospital. According to the medical superintendent at this referral hospital, which is the biggest health facility in the county, who requested to speak off record, the county had vaccinated a total of 820 people by the end of the first exercise. A close look at those vaccinated confirms that the general public has taken a back seat in the vaccination drive. Among the 820, health workers were 229, security officers 69, teachers 51, those above 58 years 232, and others were 239. According to the medical superintendent, there is vaccination hesitancy even among health workers who should ideally be in the frontline rallying people to get the jabs. So how do you guys work here?
So let me take you into our isolation ward where we admit the COVID patients.
Lucy Wangeshi is a nurse at the isolation ward in this health facility. She has also seen the effects of COVID-19 misinformation firsthand, something which she says is evident by the low numbers of COVID-19 cases the facility attends to in a month.
I don't have the actual number, but I can just give a sketch. Maybe per month, we can admit like 5 patients, 5 to 10 patients, maximum 10, minimum 5. And out of maybe 5 patients, maybe 3 turn positive, 2 turn negative. In the community, people are not so much into there is COVID. So you can hear people say, no, it's not COVID. She has cardiovascular issues, so many other things. Like in the community, people don't accept that COVID is real. But here in the hospital, as we work here, we understand. Like we believe there is COVID, people get sick, we have deaths that are happening due to COVID. Some getting well and go home, but some maybe they get to die.
Back at the county headquarters, Dr. Gathoni rules out any fear on the safety of the vaccines, which the locals here have, with most referring to the time frame within which the vaccines were developed.
The vaccine was developed in record time. And this is because the virus is the family of flu vaccines. So they already had the technology dating back to 10 to 12 years ago. So they only now went into developing the actual component for the vaccine. So it's not something that was being done from scratch. And I know this has been one of the challenges people are trying to grapple with. How come we have a vaccine so fast? But scientifically, the technology was already there. So what happened is that it was just applied now to the COVID virus because it's a virus like, especially like the flu viruses. So they just applied the technology and within time they were able to come up with vaccines.
As she checks out on the recent vaccination updates of her county, she also points out to us a raft of measures that the county government has put in place to encourage the public to come out in large numbers in the second mass inoculation drive.
I would want people to know that one, COVID-19 is a dangerous disease. It's a disease that you don't want to have. It is preventable by way of vaccination. The vaccine is available. The vaccine is safe. And we have now been able to avail the vaccine in most of our health facilities. We actually have tried to devolve as much as possible, including to health centers, to make sure that our rural population don't have to travel far. For those who are waiting for a sample size, wale ambao wamechanjwa tuone itakuwaje. I think there's fairly enough time.
If what we've seen and heard in our interactions with the locals here at Lamu County is anything to go by, then there still is a lot to be done to sensitize them on the safety and efficacy of the COVID-19 vaccine. From Lamu County, my name is Sam Abuya.